Hi, my name is Leal Herlitz. I am a renal pathologist and I work at the Cleveland Clinic. My role in KPMP is as one of the site pathologists, and that means that I actually go down to the patient room where the biopsy is being performed, and I stand outside with this elaborate cart that has all kinds of different fixatives and things that we can do with the tissue. And I wait for that tissue to come out of the patient, and then I divide it appropriately for the studies. I keep one core here at Cleveland Clinic that's called the diagnostic core, and I do the full workup that we would normally do for basic kidney biopsy that's done on any patient who might need a biopsy. And that would include light microscopy, where we look at the tissue with histochemical stains, immunofluorescence, where we would look to see if there's anything being deposited in that tissue, and then electron microscopy, where we look at a very detailed, high power level to see what's really going on at the subcellular level within these biopsy cores. And we do that kind of as a standard of care for all renal biopsies. I then share all of that information that I get from that diagnostic core with KPMP, but in addition, I take some of the cores that were part of the biopsy and I divide them up, and those go to the KPMP research groups that are looking at proteomics, genomics, and other kinds of omics to try to further our knowledge of what's going on at KPMP. I'm involved in KPMP to provide that level of expertise that we typically see in the diagnostic sphere. It's important when these biopsies are done that we can provide patients with information regarding their disease on the current level that we have as clinical understanding. So it's my job to take that diagnostic core and to process it and to issue a histologic diagnosis with the current state-of-the-art techniques that we use in renal pathology. In addition, I have to put aside those pieces of tissue for the researchers at KPMP who are going to hopefully make additional discoveries with that tissue that we normally wouldn't have access to. My real hope for the overall KPMP consortium is that we can gain additional levels of understanding that will really further our diagnostic excellence in these cases of chronic kidney disease, which are all very common, but not particularly well understood at this point. I would say one of the biggest challenges and one of the biggest frustrations that I have as a practicing clinical renal pathologist is that when I get kidney biopsies from patients with CKD, often my diagnosis is very nonspecific and I feel kind of not very helpful to the overall disease process. I feel like a lot of the times the biopsy doesn't really guide therapy or change the outcome. And really these diseases are so common and so important that I think that if we can do anything to gain additional understanding, that we can further the scientific knowledge and hopefully further the diagnostic techniques that we're able to use, that we can really start moving from the era where we don't understand these diseases very well and can't do very much about them to areas where we can really intervene and make the biopsy worthwhile and make the biopsy something that really guides clinical management and hopefully improves disease outcomes.